Welcome back to the deep dive. Okay, so before we dive in, I have a mandatory note for everyone. If you need a detailed breakdown of how prefixes, roots, and suffixes all work together, be sure to watch the previous introductory video in this series. For this session, we're assuming you've got the basics down. We are diving straight into the suffixes themselves.
Yeah, we have a lot of ground to cover to get you exam ready, so we need to be systematic. We're going to follow the structure of your source textbook and split this into two main categories.
Okay.
First, we'll do the diagnostic suffixes. These are the ones that describe conditions, symptoms, disease states, basically answering what's wrong.
And second?
Second will be the procedural suffixes. These are about treatments, surgeries, interventions. They answer the question, okay, how do we fix it?
And to make sure this all sticks, especially when you're in that exam hall, we're going to follow a really strict drill for every single term.
Okay, what's the drill?
We'll give you the clear pronunciation, the literal definition, a medical application from your text, and then we'll break the word down into its parts.
Perfect. Precision is everything. Let's start with those diagnostic suffixes.
All right, first up on the Lord is algia.
Pronounced algia. That's with a soft G.
And the definition is, well, it's simple. Pain.
Right. It just tells you there's pain. It doesn't tell you why, just that something hurts.
Okay, so let's apply that. The text gives us arthralgia. Arthro is joint, plus algia is pain.
So joint pain.
Then there's otalgia.
Oto for ear, so ear pain.
And myalgia. Myo for muscle.
Muscle pain.
Yeah.
Straightforward.
Yeah.
But here's the nuance that your text points out, and this is classic exam material. Neuralgia.
Okay, the rel is nerve, so nerve pain.
Technically, yes. But clinically, neuralgia implies a very specific quality of pain. It's not a dull ache, like, a muscle ache.
So what is it then?
It's sharp, shocking, burning, stabbing. And it follows the path of a nerve. Think of sciatica shooting down the leg. It's more of an electrical feeling.
Got it. So myalgia aches, neuralgia shocks. That's a great distinction. Okay, next up is a heavy hitter. Emia.
Pronounced emia. And this means a blood condition.
A classic example is, of course, leukemia.
Right. Leuk for white, emia for blood condition.
It's a white blood condition.
Literally, yes. But clinically, it refers to a malignant, a cancerous increase in white blood cells. It's a cancer of the blood-forming tissues.
Now, the text makes a very high-yield distinction here. Septicemia versus bacteria.
This is so important. Bacteremia is just the presence of bacteria in the blood. You might get this for a few minutes after a dental cleaning.
Okay.
Bacteria get in, but your body clears them out. It's an invasion, but a manageable one.
And septicemia.
Septicemia, or sepsis, is a systemic life-threatening infection. The pathogens are multiplying like crazy in the blood, releasing toxins. Bacteremia is a border skirmish. Septicemia is all-out war.
That's a life or death difference. Okay, another application is ischemia.
Ischemia, the literal definition, is holding back blood.
So it means there's a blockage somewhere.
Exactly. A coronary artery gets blocked. You're holding back blood from the heart muscle. That lack of oxygen is ischemia. And this is key. Ischemia leads to infarction.
Walk me through that sequence.
Ischemia is the lack of blood flow and oxygen. Infarction is the tissue death that happens because of it. So with a heart attack, the ischemia is the process. The myocardial infarction is the dead tissue left behind.
Crystal clear. Okay, moving to probably the most famous suffix out there.
Itis, meaning inflammation.
We see this one everywhere. Tonsillitis, phlebitis for a vein, cystitis for the bladder.
Colitis for the colon. It's the universal sign for redness, swelling, heat, and pain, but I want to focus on meningitis.
Inflammation of the meninges, the brain's covering.
Right, the protective membranes. Now, picture this. If you get inflammation on your arm, it can swell outwards. There's space.
Sure.
But the meninges are inside the skull, a rigid box. When they swell, they can only go inward, and that squeezes the brain. That's why meningitis is a neurological emergency.
That visual makes it really clear. Okay, next is megaly.
Megaly. Definition: enlargement.
So we have cardiomegaly, enlarged heart, and hepatomegaly.
Enlarged liver. And usually when an organ has a megaly, it's a bad sign. It means it's working too hard or it's diseased.
Okay, we need to flag this next one. It's a real trap for students.
Oma.
Oma. Definition: tumor or mass.
And the trap is that everyone assumes oma means cancer. And that's a dangerous assumption. Oma is just a mass. It can be benign, totally harmless, or it can be malignant.
You have to look at the root word.
You have to. Let's take adenoma. Adon means gland.
So benign gland tumor.
Right. But if you see adenocarcinoma...
You've added carcin. That means cancer.
Exactly. Now it's a cancerous glandular tumor. Same for muscle. A myoma is a benign muscle tumor, like a uterine fibroid. But a myosarcoma
is a malignant muscle tumor.
You got it.
But the text notes a big exception here, myeloma. Now, myoma usually means spinal cord, right?
Usually, yes. But in the term multiple myeloma, the root myel actually refers to bone marrow.
So it's not a spinal cord tumor.
No, it's a malignant tumor of bone marrow cells. That's a classic trick question on exams.
Good catch. Okay, next is oocyst.
Meaning a condition, and usually an abnormal one.
Nephrosis is a kidney condition. Necrosis is a condition of death, cell death.
Right, which can lead to gangrene. And here's another key distinction, leukocytosis versus leukemia.
We already said leukemia is the cancer.
Right. Leukocytosis is just a slight temporary increase in white blood cells.
So that's your body just fighting off an infection normally?
Precisely. Leukocytosis is the army mobilizing for a fight. Leukemia is a mutiny where the army's production goes haywire.
Got it.
Puffy.
Disease condition.
The text highlights encephalopathy and specifically mentions CTE.
Chronic traumatic encephalopathy. It's that chronic disease condition of the brain linked to contact sports.
And we also have cardiomyopathy. How is that different from a heart attack? It's about chronicity. A heart attack is an acute sudden event. Cardiomyopathy is a chronic ongoing disease where the heart muscle gets weaker over time.
Okay, let's tackle two suffixes about flow. The rrhage versus rrhage.
The pronunciation is everything here. Rhea is rhea. It means flow or discharge.
Rrhea.
Or rrhea. It means bursting forth. It's excessive.
So rhinorrhea, from rhino for nose, is just a runny nose, a simple flow.
Correct. But contrast that with hemorrhage. Hem is blood. That's not just a flow, that's blood bursting forth. It implies urgency and a lot of volume.
The menstrual cycle example in the text is perfect for this.
It is. Menorrhea is the normal monthly flow, but menorrhagia is abnormally heavy or prolonged bleeding. The suffix tells you the severity.
Makes sense. Two left for diagnostics. Sclerosis.
Sclerosis is the general hardening of arteries. But then there's atherosclerosis.
Right. Athero means fatty plaque. So atherosclerosis is hardening caused specifically by the buildup of that plaque. It tells you the why of the hardening.
And finally, urea. Urea, a condition of the urine.
Hematuria is easy. Blood in the urine. But we have to contrast that with uremia.
This is the one that trips everyone up. Hematuria is where you see blood in the toilet. Uremia sounds like urine in the blood, and it kind of is chemically. It's high levels of urea waste in the blood because the kidneys have failed.
So hematuria is a sign you can see. Uremia is a toxic blood state.
Exactly. One is a symptom, the other is a systemic failure.
Okay, before we switch gears, a quick rundown of the adjective suffixes.
These are just connectors. They mean pertaining to. Renal failure is failure pertaining to the kidney. Pulmonary is pertaining to the lung. They just turn a noun into a description.
Okay, deep breath. We've done the diagnostics. Now it's time for the procedures.
Time to treat the patient. Let's do it.
First on the procedural list
is centesis.
Centesis. It means a surgical puncture to remove fluid.
So we're not just cutting, we're draining.
We're draining. Thoracentesis is puncturing the chest wall to drain fluid. Amniocentesis is puncturing the amniotic sac. Arthrocentesis is pulling fluid from a joint.
Okay. Next is ectomy.
Removal, excision. We are taking something out.
So we have the classics. Tonsillectomy, appendectomy. But the text has a gynecological set that's really important.
Yes, a hysterectomy is removal of the uterus.
Yeah.
And the text specifies a total hysterectomy removes the uterus and cervix, while a subtotal leaves the cervix.
And then there's oophorectomy. Ovary removal.
Fallopiectomy.
Fallopian and tube removal. And don't forget cholecystectomy, that's gallbladder removal. If it ends in wansopectomy, that organ's gone.
Okay, next step. Plasty.
Plasty, surgical repair.
Rhinoplasty is a nose job. Mammoplasty is breast repair. But the big clinical one is angioplasty.
Right, angio for vessel, so vessel repair. Usually we inflate a balloon inside a blocked artery to smash the plaque open and then place a stent, which is like a mesh tube, to keep it open.
Okay, moving to visual exams.
Yeah.
Tescopy.
Scopy. The process of visually examining something, usually with a scope.
So bronchoscopy for the lungs, laryngoscopy for the voice box.
And laparoscopy for the abdomen. It's also called keyhole surgery. Instead of one big cut, we use small holes.
And stomy.
Stomy. It comes from the Greek stoma, for mouth. It means you're creating a new opening, one that's usually semi-permanent.
So a tracheotomy is?
The incision you make in the windpipe, the act of cutting.
And the tracheostomy is?
The opening itself, or the tube placed in it. You've made a new mouth for the airway. Same with a colostomy. a new opening from the colon to the outside. And there's an internal version called an anastomosis that's creating a new connection, a new mouth, between two internal tubes, like reconnecting the intestine after you've removed a piece.
Almost there. 2 more. Treatment.
Chemotherapy, radiotherapy.
Yeah.
And the text mentions cryotherapy.
Cryo for cold. So it's using liquid nitrogen to freeze and destroy tissue, like warts.
And last but not least, lysis.
So this means separation, breakdown, or destruction.
The main application here is dialysis.
Literally complete separation. When the kidneys fail, dialysis separates all that waste from the blood.
And the text gives 2 types.
Right. Hemodialysis, where a machine filters the blood, and peritoneal dialysis, which uses fluid in the abdomen and the body's own membrane, the peritoneum, as the filter. I mean, it's a marathon for sure, but it's a necessary one.
So let's zoom out. We've gone through all these terms. Why is mastering this so critical for the students listening? Because, like we said at the beginning, it's not a phone book, it's a logic puzzle. If you master these suffixes, you crack the code. You can see a word you've never encountered before on an exam, like, say, encephalomalacia.
Okay, I have no idea what that is.
I'll let you know the parts. Encephal means brain, and if you know that malacia means softening,
you can figure out it means softening of the brain tissue.
without ever looking it up, that's the power of it. It puts you in control of this huge, intimidating language.
That's a great way to think about it. You're not just memorizing, you're building a toolkit.
You're learning the rules so you can handle anything that comes your way.
To all of you listening, we know the pressure is immense, but keep drilling these parts. It really is the fastest path to fluency.
And keep asking questions of the words. Is it a flow or a bursting forth? A cut or a new opening? The answer is right there in the suffix.
A final thought to leave you with: how new technology creates new terms. As you start your careers, you're going to see new suffixes pop up as medicine advances. The language is live, and you'll be a part of its evolution.
Absolutely.
Remember to subscribe to the channel so you don't miss the rest of this medical terminology series. We have roots and prefixes coming up next. Thanks for listening to this deep dive.
Good luck with your studies.